We may have some help for thousands of us back pain sufferers here in the West Midlands. A new non-surgical treatment has arrived from America, and a clinic in Moseley is the first centre in the West Midlands to offer it. Director of Birmingham Chiropractic Clinic, Dr. James Rousseau. Tell us more, please, Dr. Rousseau.
Good morning.
Good morning.
I was very impressed with the results that they were getting in the States with this. There are certain cases where we're restricted in our conservative approach, most notably where we have a severe disc problem. These prove very resistant to normal conservative care, and very often the only alternative is surgery. And I was so impressed with these results that they were getting in the States when this became available in this area. Bearing in mind, it's very new in the country. There are only 6 centres in the country, and I believe I'm the first chiropractor to actually start implementing this therapy, and it's really, really new.
So it's been in America for how long?
Yeah, since for the past 10 years or so. But sometimes these things take a long time to translate across. And of course, I think that we're rather conservative in this country. We don't jump at the first available new gadget.
Yeah, we wait, we see, we ponder, and then we realise we've all still got our back pain, so we might as well give it a go.
That's right.
What interests me about this is, I'm trying to stress, it's non-surgical. You know, it doesn't involve a scalpel, it doesn't involve a surgeon. Yeah. And that's the trouble with a lot of back problems, isn't it? They're not as easy to fix as going and having a new hip if you've got hip arthritis. You know, the last thing anybody wants is to go and have an appointment with a spinal surgeon. Because
that spine is so important. You know, it houses the central nervous system. Anything goes wrong there, and you can have a whole plethora of problems as a result.
How many of us suffer, do you think, in this country with back problems, and why is it such a big problem when we're looking at our social lives and our working life?
The first question is, I don't have figures at hand, but I know it's the largest loss to industry for time off work. And there are many approaches to chiropractic, to back care, and we find that research was done recently on the people who carry and move these heavy barrels of beer, and what was found, that they didn't really suffer from back pain because they did their work in short spurts and they had good rest between deliveries. But we find that people sitting at computers, sitting on the floor, these kids playing these games for prolonged periods, really weakens the spine, and we become more sedentary. And in the olden days, the people used to have good food, nutrition, and be very active, and we've become more sedentary. And
so even though there's a lot more research into how we lift, let's say, patients, how doctors and nurses lift patients, how people lift heavy objects, you're saying it's actually our sedentary lifestyle that causes more problems, and actually these guys that pick the big barrels of beer up, which is a very, very interesting point. If you'd like to speak to James Rousseau, our back specialist in the studio this morning, do give us a call, 08453 009956. He's a chiropractor, he's got a clinic in Moseley, and his voice is very familiar to all of us here on BBC WM. James Rousseau is in the studio with us this morning from the Birmingham Chiropractic Clinic here in Moseley in Birmingham. He's in to tell us about a new non-surgical back pain treatment that could help many of us here in the West Midlands. You've talked to us about what kind of people you can help with this, James. So how does it work, and what does it involve?
Well,
what's it called?
It's called IDD, which is Intervertebral Differential Dynamics.
Intervertebral Differential Dynamics. That sounds easy to understand, not?
Well, if you think in terms of decompressing, a non-surgical decompression, where a disc becomes compressed and it bulges, puts pressure on nerves, that can create a common thing, as we know, sciatica. It can also happen in the neck, and we can get arm pain or weakness. So when the disc loses its fluid and its flexibility, and it gets compressed, puts pressure on the disc, on the nerve, and this treatment is aimed to specifically aim at that particular disc, which is A normal traction would be a longitudinal traction, would traction all vertebra on that line. But with this computerized mechanism, we're able to target very, very specifically to the affected vertebra, to the affected disc, because you don't want to treat the ones that don't need treatment.
So what are you doing to that disc then? Lasering it? Or?
No, what it is a distraction, and it's a oscillation. So what happens is that the disc, the vertebra above and below get distracted, which creates a negative pressure inside the disc, which helps to draw the fluid back in toward the disc. And then once the disc becomes distracted, then there's a slight oscillation for about 5 minutes. And then it releases again. And then after a rest period, it re-distracts the disc, and then it oscillates it.
So as a patient, I'd be lay flat on my front on your couch with this machine. You have to isolate, obviously, the disc was passing me a leaflet now, the disc. But, you lay on your front with this?
You lay on your back.
Oh, sorry. Yes, you lay on your back, so you're facing upwards.
Yeah. So
it's working underneath the spine.
Yeah, you're working on you're harnessed and strapped to the table, and then depending which disc. So it's important to have an MRI to identify the level of disc of involvement, and then depending on your weight and your size, the angle is calculated to be able to specifically target that disc. So you put into a harness, and then the table distracts on a very, very gentle and very, very gradual scale.
What do you mean by distracting?
What happens is that if the disc is compressed, if the two vertebrae are compressed together, then we need to be able to distract.
So you're pulling them apart
slightly. That's right. Very gently.
Gosh, it looks like a torture contraption, actually, the pictures, James, but you are strapped in, and then you sort of go vertical. So again, that's sort of the weight.
You start vertically, and then you lie down onto your back.
Gosh.
And then the harness, the attachment rises to the angle which aims specifically at that.
You've got to have an MRI first. Yes. How many treatments do you need? How much does it cost?
Well, it varies. Mostly we work at about 20 sessions spread over a month and a half, and we start off with a couple of weeks where we do 8 daily for 2 weeks, and then for 2 weeks we do 3.
This is sounding really expensive, James.
It works out about £1,200, but bearing in mind this is for cases that are facing surgery, and the cost of surgery, of course, is a lot more than that.
And this is non-surgical, so it keeps people away from the surgeon's knife. We're talking about back pain and this new non-surgical treatment. James Rousseau is offering it at the Birmingham Chiropractic Clinic. We believe he's the first person to be offering it in the West Midlands. If you dispute that, do get in touch. You're welcome to call 08453 00 9956.